Hi, welcome to Body Beautiful. I'm Janelle Marie. This is the show where we talk with local professionals about the latest in medical devices and procedures. And remember, any advice we give you today, consult your physician first. And today we have with us plastic surgeon Dr. Joseph Mealy. We are actually in his Walnut Creek offices today, socially distancing. And Dr. Mealy, I am proud to say we are celebrating your 50th Body Beautiful show right here on KRON 4. I know, 50 shows. Can you believe that?
Boom, 50 more coming at you.
Absolutely, 50 more coming at you. And we're so glad to have you on our KRON 4 airwaves. Congratulations on your 50th show. We got you a cake, and we are going to socially distance eat that later, that's for sure.
Yummy.
But anyway, thank you for being on our airwaves for 50 shows, and it's so wonderful to have you. So we've got a lot to talk about today, I'm telling you. We have got breast augmentation revision, which is very important, otoplasty, we're going to talk about blepharoplasty, and we also are going to talk about post-bariatric plastic surgery.
Sure.
And that's very important because we're going to start with that, post-bariatric plastic surgery. A lot of people, doctor, having bariatric surgery nowadays. So let's tell our viewers who may not know that, what is it?
So bariatric surgery is surgery that's for weight loss.
Okay.
So for people who are significantly overweight, there are health benefits to losing that weight, and sometimes diet and exercise are not enough.
Exactly.
I feel like I get to help complete the journey after the weight is lost by getting rid of the extra skin, and it just makes people feel better about what they've accomplished.
Yeah, because a lot of people don't realize once you lose that weight with that surgery, there's a whole lot of loose skin to deal with. Am I
Often
right?
there's loose skin, and the part that keeps me interested is everyone expands and shrinks differently. So there's different parts get loose and get loose in different ways. So a lot of the procedures we do after weight loss are the same ones we would do after pregnancy or the normal sort of cosmetic surgery that we do, but they need to be modified a little bit. Sometimes a little more extreme, sometimes a little less, depending on what we're up to.
Because a lot of people's skin just doesn't shrink right away after
Correct.
surgery. I mean, some people will do better than others, but it just doesn't shrink like that, right?
Correct. I mean, it helps to be younger, it helps to
Yeah.
be in shape, it helps to have good circulation, but there's a certain amount of stretching that becomes an encouragement for skin to grow.
Yes.
And the skin then does not shrink and go away after the weight is lost.
Well, let's take a look at the pictures because we do
Sure.
have pictures for post-bariatric plastic surgery. Let's go to picture number 1. What's going on here, doctor?
Right, so this is a patient who's had a tummy tuck.
Yes.
So when she gained and lost
Beautiful.
weight, the extra skin sort of stretched forwards. We see this also with pregnancy. You can kind of see the upper part of the abdomen sticks out a little bit more.
Yep.
Because the muscle's been stretched out. And that's very common with men with weight gain. We tend to put it inside rather than outside. So a
And-
tummy tuck not only gets rid of that skin and the
Yeah.
fat, but it also tightens the muscle, which is the foundation to a flat belly.
And that is a beautiful after picture, a very natural look. And I mean, you can see the scar, but
You
the
can
scar.
see the scar. I have
know.
to say, most of my post-weight loss patients really don't care about the scar. They really want to
Exactly.
fit in their clothes.
Exactly. And let's go to picture number 2. This is
So this is an arm lift.
Yeah.
So this is someone who has 2 or 3 amount of skin that she needs for her arm. She's gained a lot of weight, the arm got quite a bit larger, and then when the weight is lost, the fat really all went away. There's very little fat left on her
Yeah.
arm, but there's a lot of skin.
Now, can post-bariatric surgeries be combined? Can you do these together?
Sure. No, often we're doing arms with a breast lift or sometimes even breast augmentation if too much volume is lost. The bellies, sometimes we have to go all the way around and do a lower body lift. Sometimes we're doing it with a thigh lift if the thighs are a problem. So we often combine them. I wouldn't try to do everything at once because we
Right.
have to be safe, but combining them can help in terms of recovery times.
And this arm, that looks beautiful. I can't see the scar here, so you do hide the
There's
scars
definitely
when
a
you do the
scar,
arm.
yeah.
Yeah.
So the scar extends from the inside of the elbow to the back of the armpit. And that seems to be the best place to hide it. 'cause
Looks great. I
with
mean,
your
her
arm in any
muscles-
low position, you can't really tell where it is.
Exactly. And her muscle is defined now. I mean, that is a great job before and after. The after picture is amazing.
So muscle definition's all her. She worked very
Yeah.
hard, but was not happy with the skin hanging
Right.
off of it.
And a lot of people don't realize that skin can be very heavy.
It can be heavy and it
Very.
moves and
Yeah.
it doesn't fit in a sleeve well.
Let's go to picture number 3.
So this is a trunk of a man
Okay.
who obviously gained a lot of weight in the chest, and as that deflated, the skin dropped. The nipple, the areola got stretched out, and he also has some laxity in the lower belly. Now he's lost this. He now does good diet. He has good exercise. His muscles are in great shape, but he's not happy when he looks in the mirror.
And so he only had to get the torso done. He didn't have to do arms and all that. So
Correct. So in
okay.
his case, it was the trunk kind of took the hit.
right.
So we're able to do a sort of a gynecomastia reduction surgery, but in this case, you can see the scars underneath the nipples because I've
Yep.
removed skin in order to bring everything up. The nipples in this case were actually taken off like a skin graft and
Oh,
moved
wow.
up to where we want them because as I remove that extra skin, the nipple's in that skin.
And what is the recovery time? Let's say you had this surgery or you had the arm surgery. What's the recovery time usually?
So with the arms, usually pretty fast. You have to wear a sleeve, a garment for a couple of weeks, a day and night, and then half the time for another 4 weeks or so. Sometimes the hands swell, our hands feel a little tired just because we've tightened up that skin. But I'd say most people in a couple weeks are back to doing what they want to do.
And the last picture?
The last picture is a thigh lift.
Love
so
that.
this is a back view. I know I've showed the front views before. Don't often see the back view.
That is great.
But you can see it kind of elevates the butt a little bit. Also opens up that space between the thighs, which was really annoying her. It would still rub and cause irritation.
And did this woman only have the thigh lift? Did she have to do any others?
I think we just did the thigh lift. At least during that one surgery, we just did the thigh lift.
And will the skin continue to shrink after you do the skin surgery? Will the skin continue to shrink on its own, or it just depends?
Usually not. Usually we wait, and if someone's lost 150 pounds, we usually wait a year before embarking on the reduction surgery, because some of that skin will shrink on its own. After about a year, it's kind of shrunk as much as it's going to shrink.
All right, Dr. Post-bariatric plastic surgery, there you go. Remember, if you want more information on this or anything else the doctor can provide you, just call the office at 925-943-6353. And remember, you can see all these before and after pictures on the websites, drmealy.com or sanfranciscobreast.com. We have a lot more coming up on Body Beautiful. Keep it right here.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.